Hi, I am Peter Glowitsky from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. We are pleased to bring you the September issue of our journal with several excellent papers on venous and lymphatic diseases. The Editor's Choice article this month is entitled, "Age is not a barrier to good outcomes after varicose vein procedures." This is a retrospective review of prospectively collected data of 4,841 varicose vein procedures from the Vascular Quality Initiative Varicose Vein Registry, written by Dr. Daniel Sutko and colleagues from the University of Michigan in Ann Arbor and the New York University Langone Medical Center in New York. It is a timely article since coverage of varicose vein procedures in Medicare patients have been threatened, and evidence on effectiveness of vein procedures in the elderly has been sparse. Dr. Sutko and colleagues investigated the benefits of vein procedures in the Medicare population and compared outcomes with those achieved in younger patients. The authors found that patients and patient-reported outcomes in 1,068 patients aged 65 years old or older resulted in similar improvement than observed in 2,691 patients younger than 65 years of age. Venous clinical severity score improved also significantly in both age groups. While there was no difference in improvement in the venous disease severity score, younger patients had more significant improvement in patient-reported outcome than Medicare patients. Based on these findings, Medicare patients appear to benefit from varicose vein procedures, and they should not be denied interventions on their venous insufficiency based on age alone. The next paper that's available for free download this month is entitled "Impact of an Inferior Vena Cava Filter Retrieval Algorithm on Filter Retrieval Rates in a Cancer Population," written by Dr. Litwin and colleagues from the University of Texas MD Anderson Cancer Center and the Houston Methodist Cancer Center. This retrospective study assessed the impact of IVC filter retrieval algorithm in cancer patients and the risk of recurrent thromboembolism in those who underwent filter retrieval. Most patients who underwent filter removal had no clinical contraindications and had an estimated life expectancy beyond 6 months. In 396 cancer patients, by using an IVC filter retrieval algorithm, retrieval rate increased significantly from 17.3% to 32.8%. The incidence of recurrent thromboembolism in this group after filter retrieval was only 2.5%. The authors suggest using an IVC filter retrieval algorithm to improve retrieval rate of filters in cancer patients. The next paper I would like to introduce is on the natural history and outcomes of line-associated upper extremity deep venous thrombosis in critically ill patients, written by Dr. Underhill and colleagues from the University of Michigan Ann Arbor. This is a retrospective single-center cohort study that found that 75.8% of 161 ICU patients with acute line-associated upper extremity deep venous thrombosis were treated with full anticoagulation. They also observed that major hemorrhagic complications were significantly more common across multiple treatment groups than symptomatic pulmonary embolism in the entire cohort. So, based on these findings, the authors suggest that current treatment guidelines for line-associated upper extremity deep venous thrombosis may be too aggressive and may result in more harm than benefit to these critically ill patients. The final paper I would like to present from the September issue is on evaluation of thrombolysis using tissue plasminogen activator in lower extremity deep venous thrombosis with concomitant femoropopliteal venous segment involvement. In view of the negative results of the recently completed ATTRACT trial, the experience reported here is indeed valuable. In this retrospective single-center case control study, 3-month outcomes of 89 patients with deep venous thrombosis involving the femoral popliteal venous segment who underwent catheter-directed thrombolysis were compared with outcomes in 102 patients who were treated with standard anticoagulation alone. 93% of the patients also had iliofemoral deep vein thrombosis. Primary outcomes included patency at 3 months, post-thrombotic syndrome measured with the Villalta score, and valve dysfunction. Outcome in all 3 categories were significantly better in the group treated with catheter-directed thrombolysis. These results were achieved without increase in bleeding complication, which indeed were significantly less frequent in the thrombolysis group than in those treated with anticoagulation alone. There was no difference in in-hospital mortality or pulmonary embolism between the groups. The authors suggest using catheter-directed thrombolysis for treatment of femoropopliteal DVT if there is no contraindication and there is associated iliofemoral deep vein thrombosis. These were just a few of the many outstanding articles from our September issue. To access these articles free this month, please download them on www.jvsvenus.org. Enjoy reading all JVS journals and let us know any comments or suggestions you may have to improve our publications. See you next time for the highlights of the November issue of the JVS Venous and Lymphatic Disorders.